Not to make light of COVID-19, or discourage observance of reasonable health precautions, I offer the following for perspective. COVID-19, the little virus that could take down the world. I understand the threat of COVID-19. However, I believe the drastic measures taken to suppress it will be far more damaging than the virus itself. Physical, mental, and economic health are being gravely compromised for an unknown benefit, if any. I ask consideration of the following data with respect to COVID-19, SARS-CoV-2. As of April 8, 2020, in the world, there were 83,568 deaths. In the US there were 12,912 deaths. These numbers will rise, but some 4 months into the pandemic, they are a useful reference for comparisons. Incongruent action-reaction. The 1918 Spanish flu killed an estimated 50 million in the world. The 1968 Hong Kong flu killed a million in the world and approximately 33,800 Americans in 6 months. The London flu killed 57 Californians the first week of January, 1973. The 2009 swine flu killed between 151,000 and 575,000 people worldwide and 17,000 Americans. The 2017-18 flu season killed up to 80,000 Americans. On March 28, 2020, in the U.S., CDC estimates that so far this season there have been at least 39 to 55 million flu illnesses, 400,000 to 730,000 hospitalizations, and 24,000 to 63,000 deaths from flu. As of March 21, 2020, 155 children also died from influenza-associated illness. Clearly, most of the foregoing, and ongoing, epidemics were more impactful and lethal than COVID-19. Yet, except for the horrific Spanish flu, there were no draconian measures taken. No shutdowns, no closures, no media hysteria, no death clock, no economic meltdown, no masks or gloves. It is said COVID-19 is different, a cold virus/not flu, and it's just getting started. So, they say, but why was there no such speculation and hysteria over those incipient deadly viruses at the time? Voltaire, those who can make you believe absurdities, can make you commit atrocities. A people that can be easily misled and panicked by hyperbole is concerning. Once you get used to accepting what you are told without questioning it, no matter how absurd, you lose the ability to understand what is good or bad. If people are willing to shut everything down and agree to solitary confinement, what else might they be compelled to do? The elderly, irrespective of their individual health, have already been stigmatized as vulnerable, or, along with Asians, possible vectors. Hence these types are to be avoided or shunned. Congregators and dissenters may be shamed, or eventually coerced, into separation and silence. Who will be next, and to what may they be subjected? Instead of enthusiastically hyping the COVID-19 body count, why are we not informed of these past outbreaks that were far worse? Where are the healthcare professionals and scientists who must know these truths? Where are the responsible journalists to inform the public of these vivid contrasts that don't square with the hysterical story we're being told? Where is the responsible leadership to put things in perspective and offer calm? Where are the skeptics, the inquirers, the challengers? There are several, and I offer brief excerpts. Some posit theories I don't necessarily endorse, but I believe worthy of presenting. Please search the web, if you please, for more vital information. 1. A Fiasco in the Making, by John P. Ioannidis, Professor of Medicine and Epidemiology at Stanford. The data collected so far on how many people are infected and how the epidemic is evolving are utterly unreliable. Reported case fatality rates, like the official 3.4% rate from the World Health Organization, cause horror and are meaningless. A population-wide case fatality rate of 0.05% is lower than seasonal influenza. If that is the true rate, locking down the world with potentially tremendous social and financial consequences may be totally irrational. It's like an elephant being attacked by a house cat. Frustrated and trying to avoid the cat, the elephant accidentally jumps off a cliff and dies. Flattening the curve to avoid overwhelming the health system is conceptually sound in theory. One of the bottom lines is that we don't know how long social distancing measures and lockdowns can be maintained without major consequences to the economy, society, and mental health. Unpredictable evolutions may ensue, including financial crisis, unrest, civil strife, war, and a meltdown of the social fabric. 2. Such Sucharit Bhakti, Professor Emeritus of Medical Microbiology at the Johannes Gutenberg University, in an open letter to German Chancellor Dr. Angela Merkel, makes the following points. A dangerousness. The internationally recognized International Journal of Antimicrobial Agents will soon publish a paper that addresses exactly this question. Preliminary results of the study can already be seen today and lead to the conclusion that the new virus is not different from traditional coronaviruses in terms of dangerousness. B. Mortality. At the same time, the mistake is being made worldwide to report virus-related deaths as soon as it is established that the virus was present at the time of death, regardless of other factors. In an interview, Professor Buckbee condemns the extreme and costly measures being taken around the world as grotesque, useless, self-destructive, and a collective suicide that will shorten the lifespan of the elderly and should not be accepted by society. 3. Jonathan Cook in Global Research, April 3, 2020, the bigger picture is hiding behind a virus. Our current fear is an enemy to our developing and maintaining a critical perspective. The more we are frightened by graphs, by deaths, the more we are likely to submit to whatever we are told will keep us safe. Politicians controlled by big business and media owned by big business are pushing through this corporate robbery without scrutiny. There are many other dramatic changes being introduced, almost too many and too rapidly for us to follow them properly. Bans on movement. Intensified surveillance. Censorship. The transfer of draconian powers to the police, and preparations for the deployment of soldiers on streets. Detention without trial. Martial law. Editor's note, April 5, 2020, Riverside County, California, this weekend took one of the state's strictest measures to combat the spread of COVID-19 by banning all gatherings with non-household members and ordering all residents to wear face coverings outside. Meanwhile, public health officials continue to broadcast mixed messages about face masks. Ron Paul, former congressman from Texas, noted, "Our country is far less at risk from the coronavirus than it is from the thousands of small and large authoritarians who have suddenly flexed their muscles across the country." President Donald Trump would do well to end this ridiculous shutdown so that Americans can get on with their lives and get back to work. 4. Professor Michel Chossudovsky, Fake Coronavirus Data, Global Research. What is more dangerous, seasonal influenza or COVID-19? Based on the figures below, see website. The recorded annual death rate pertaining to influenza is substantially higher than that pertaining to COVID-19. The unspoken truth is that the novel coronavirus provides a pretext to powerful financial interests and corrupt politicians to trigger the entire world into a spiral of mass unemployment, bankruptcy, extreme poverty, and despair. In some countries, martial law has been declared. The WHO's global health emergency was declared on January 30, when there were 150 confirmed cases outside China. From the outset it was based on a big lie. When the lie becomes the truth, there is no moving backwards. 5. MIT biologist Dr. Shiva Ayyadurai holds 4 PhDs from MIT. The current trajectory of Dr. Anthony Fauci's public health policy will result in the short and long-term destruction of our citizens' immune health as well as our nation's economic health. In the current situation purposely driven by fear-mongering and fake science, Dr. Fauci, his allies, Big Pharma, Gates Foundation, Clinton Global Initiative, Chan Zuckerberg, WHO, CDC, and the Chinese Communist Party, CPC, will profit enormously, both politically and economically, at the expense of the American working people. 6. Alex Berenson, former NYT reporter, NYT best-selling author, has come to the conclusion that the strategy of shutting down entire sectors of the economy is based on modeling that doesn't line up with the realities of the virus. He says that outside of places like New York there has not been a national health crisis that was predicted, nor are there signs that the level of lockdown in various states has made a difference. There doesn't seem to be any correlation between the lockdown and whether or not the epidemic has spread wide and fast. Now we're in a bad spot because there's clearly a dangerous political dynamic right now. The economy is in free fall. A lot of people are hurting. If we acknowledge what is clearly happening, the people who made these decisions, I think there's going to be a lot of anger at them, so they don't want to acknowledge it, so they say, oh, it's the lockdown that saved us. 7. Dr. Scott Jensen, a Minnesota family physician who is also a Republican state senator, told the Ingram Angle Wednesday that the Centers for Disease Control and Prevention's CDC guidelines for doctors to certify whether a patient has died of coronavirus are ridiculous and could be misleading the public. Host Laura Ingram read Jensen the guidelines, which say, In cases where a definite diagnosis of COVID cannot be made but is suspected or likely, e.g. the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. In response, Jensen told Ingram the CDC's death certificate manual tells physicians to focus on precision and specificity, but the coronavirus death certification guidance runs completely counter to that axiom. Jensen then told Ingram that under the CDC guidelines, a patient who died after being hit by a bus and tested positive for coronavirus would be listed as having presumed to have died from the virus regardless of whatever damage was caused by the bus. 8. Mark Levin, former Reagan Justice Department official and TV/radio host, what happens after we are done hunkering down? Levin went on. Doesn't that mean millions of people never had the virus because they successfully hunkered down? Doesn't that mean millions of people will be highly susceptible to getting it again or getting it the first time? They are not developing an immunity. Are you tracking the number of people who might have lived but for the directive against so-called elective surgery? Individuals with heart disease, cancer, diabetes, etc.? What are the numbers of suicides so far in February and March that have occurred? We have no idea. 9. Victor David Hanson, an American classicist, military historian, columnist, and farmer, thinks the outbreak likely started much sooner than late December of last year, when China says the outbreak began in Wuhan, and that Californians developed some degree of herd immunity through earlier exposure to the virus than the rest of the country. New York State, the epicenter of the outbreak, has reported 32 times as many deaths per 100,000 residents as California according to CNN's latest tally as of Wednesday morning. Stanford Medicine is conducting a study that may back up his assertion. 10. Can we trust the WHO? By F. William Engdahl, April 3, 2020, Global Research. The fact that many of the members of WHO's SAGE have financial ties to the Gates Foundation is highly revealing. The drug makers gave tens of millions of dollars to WHO in 2017. In early March, Oxford University stopped using WHO data on COVID-19 because of repeated errors and inconsistencies the WHO refused to correct. The WHO test protocols for coronavirus tests have repeatedly been cited by various countries including Finland for flaws in false positives and other defects. Editor's note: it's noteworthy the aforementioned discredited WHO is in perfect sync with the CDC, ECDC, and NHC, all cited as death clock sources. Are we to presume they all share the same conflicts of interest, errors, false positives, and other defects? Who is checking who? Moreover, attributing all deaths to COVID-19, when other more likely causes are present, is misleading, as Dr. Sucharit Bukti and Dr. Scott Jensen note above. More importantly, the question remains, why weren't those previous epidemics, Hong Kong, London, swine, hyped before 200 US deaths, as was COVID-19? Social distancing for good cause is an ancient practice. Humans have always kept their distance from sick people and diseased areas. We know now, well-looking people may be infectious, but that has always been, and will always be the case. From now on then, do we keep 6 feet apart? Are your hands really clean? What's on that surface? What's in the air around you? Are you a carrier? Have you inadvertently sickened or killed people? Don't touch your face. I wish you well going down that unhappy, paranoid, OCD rabbit hole of endless worry, doubt, and anxiety. How fortunate for governments that the people they administer don't think. I've witnessed swooning comparisons between COVID-19 and World War II, Pearl Harbor and the Blitz over London. As though comfortably self-isolating, readying for a heart attack and/or nervous breakdown, over a hypothetically less deadly virus than the seasonal flu, is equal to being savagely attacked, shelled, bombed, machine-gunned and brutally murdered. What must survivors of those horrors think? What would the hard pioneers and dauntless settlers of America think? I wouldn't object to a collective war on any disease, if it were justified by numbers, like the Spanish flu. But COVID-19 just doesn't add up in terms of immediate impact or lethality. As noted earlier, it doesn't even match the seasonal flu, much less swine, Hong Kong or Spanish flu. 24/7 Dire News reports projecting wild future death estimates and protracted closures couldn't be more counterproductive. Outside visuals become more surrealistic by the day. Why is this happening? Not to invoke a connection, but to consider a range of possibilities. How the CIA overthrew Iran's democracy in 4 days, NPR. Psychological warfare. I've never been a conspiracist, but I am at a loss to explain what I am witnessing otherwise. I hope it's just a perfect storm of hype, ignorance, and malfeasance that will soon pass without irreparable damage. Of course, if that's the case, no one will ever admit they were stone-cold duped and caused horrific, irrevocable damage. Oh no, when the virus recedes largely on its own, as they always do, let the celebrations and backslapping begin. Our brilliant policies and collective sacrifice saved the world. The whole aim of practical politics is to keep the populace alarmed, and hence clamorous to be led to safety, by an endless series of hobgoblins, most of them imaginary. H. L. Mencken. But if COVID-19 can be propagandized and utilized as a psychological weapon to frighten and manipulate people, a bleak, terrifying future awaits. If we are going to react like this every time an unknown virus, or whatever, comes along, frequently, we might as well surrender to permanent lockdown. No bombs or bullets needed to fracture and subdue an ingenuous population. Some believe the virus is cover for a new world order and martial law with the approval of frightened citizens. Scare them with a contagion, and shortly they'll disunite and fear one another. Superstition, distrust, and animosity will replace reason, community and selflessness. They will surrender all for the false promise of personal safety. I don't wonder what it's like inside an insane asylum anymore. All I have to do is go outside. In the long run, it may turn out that rascality is necessary to human government, and even to civilization itself. That civilization, at bottom, is nothing but a colossal swindle. I do not know, I report only that when the suckers are running well the spectacle is infinitely exhilarating. H. L. Mencken, last words. Steve King, Carpinteria, CA. Registered Sanitarian Certificate Number 3180 State of California, Department of Public Health, January 1, 1969.